Nagaland registered the highest single-day spike of 26 COVID-19 cases till this morning, taking the total number of infections in the state to 156. 23 new cases are reported from Dimapur, 2 from Kohima and 1 from Peren. With 30 recoveries as of this morning, there are now 126 active cases in the state. India record over 10,000 new cases in a day for the first time since the COVID-19 outbreak, taking the tally to 2,97,535, while the death toll rose to 8,498. India also goes past the United Kingdom to become the fourth worst hit nation by the COVID-19 pandemic. Number of active cases stands at 1,41,842 with 1,47,194 recoveries. And northeastern states gear up for digital state secretariats, which will ensure that work from home is possible in the COVID-19 lockdown period. Union Minister Dr. Jitendra Singh addresses an exclusive virtual meet with chief ministers of the region, which focused on e-office for northeast states with the objective to create digital state secretariats in these states. Well, hello viewers and a warm welcome to this news broadcast from News and Trends. Nagaland registered the highest single-day spike of 26 COVID-19 cases till 8:25 a.m. this morning, taking the total number of infections in the state to 156. According to updates by Nagaland Health and Family Welfare Minister S. Pangyu, 23 out of 26 new cases were from Dimapur quarantine centers, while there were 2 cases from Kohima. Peren also reported another case. In his first of his 2 tweets this morning, the minister informed that 17 new cases of COVID-19 positive have been reported out of 67 samples tested at Dibrugarh. All patients are from Dimapur quarantine center, he tweeted. In his second tweet, which came after about 2 hours later after his first tweet, the minister said another 9 new cases of COVID-19 positive have been reported out of 251 samples tested at NHAK Kohima. 6 patients from Dimapur quarantine center, 2 from Kohima quarantine center, and 1 from Peren quarantine center. With this, Nagaland's tally of COVID-19 positive cases stand at 156. However, with 30 recoveries as of this morning, there are now 126 active cases. For the first time since the COVID-19 outbreak, India recorded over 10,000 new cases in a day, taking the tally to 2,97,535, while the death toll rose to 8,498 with a record single-day spike of 396 fatalities according to the Union Health Ministry data. The country has registered 10,956 new coronavirus infections in the last 24 hours till 8 this morning. India yesterday went past the United Kingdom to become the 4th worst hit nation by the COVID-19 pandemic, according to the Worldometer. The number of active cases now stand at 1,41,842, while 1,47,194 people have recovered and 1 patient has migrated, it said. Thus, around 49.47% patients have recovered so far, an official said. The highest number of confirmed cases in the country are from Maharashtra at 97,648, followed by Tamil Nadu at 36,716, Delhi at 34,687, and Gujarat at 22,032, according to the Health Ministry's data updated in the morning. In the northeast, Assam has reported 3,319 novel coronavirus cases so far. A total of 913 cases has been reported from Tripura. Manipur has 366 COVID-19 cases. Nagaland has 156. Mizoram has 102. Arunachal Pradesh has 61. Meghalaya 44, and Sikkim has reported 14 cases till now. Northeastern states are gearing up for digital state secretariats on the lines of the central government's Digital Central Secretariat. According to official sources, the progress of e-office in 75 central ministries and departments have enabled the creation of a digital central secretariat which ensured that work from home was possible in the COVID-19 lockdown period. Similarly, the implementation of e-office in state secretariats of northeastern states will result in creation of paperless state secretariats in a time-bound manner, where offices would be empowered with virtual private networks, digital signature certificates, and promote less contact governance. Governments of Arunachal Pradesh, Assam, Manipur, Meghalaya, Mizoram, Nagaland, Sikkim, and Tripura are ready to embrace digital technologies. In this regard, Union Minister of State for Personal, Public Grievances and Pensions, Dr. Jitendra Singh, today addressed an exclusive virtual meet which focused on e-office for northeastern states with the objective to create digital state secretariats in northeastern states of India. The workshop on e-office for Northeast states was attended by chief ministers of all the northeastern states. Nagaland Chief Minister Nipirio tweeted saying, attended webinar on implementation on e-office in northeastern states organized by Department of Personal Public Grievances and Pensions, Government of India, towards digital state secretariats which will result in creating paperless state secretariats in a time-bound manner. It was addressed by Dr. Jitendra Singh.
The proposal by the Government of Nagaland for initiating an e-office so that all file tracking management and all that will be done electronically has reached the donor ministry, and the minister himself has acknowledged that that is the priority of the Prime Minister's program. Secondly, he also reminded the donor minister that the submissions already made for the airport in the capital be reminded for renewal, and during this pandemic, to ensure that our economic policy for the unemployed youth will be facilitated and supported if one of the major projects which we have already placed before the Government of India, which is the Trans-Nagaland Highway, or popularly known as the Footy Road, be taken up on priority.
Meanwhile, the Chief Minister also informed of the high-powered committee's virtual conference with the district task forces to take stock of situation regarding COVID-19 positive cases, quarantine centers and testing facilities in the districts. Rio said he solicited their views on reopening of religious worship places and business activities. The total number of global coronavirus has increased to 75,13,208, while the death toll has reached 4,21,428, according to the Johns Hopkins University, with 20,23,385 confirmed cases and 1,13,818 deaths. The US currently accounts for the highest number of infections and fatalities in the world. In terms of cases, Brazil comes in the second place with 8,02,828 infections. This was followed by Russia with 5,01,800, India with 2,97,535, and the UK with 2,92,860. Regarding fatalities, the UK continues in the second position after the US with 41,364 COVID-19 deaths, which also accounts for the highest fatalities in Europe. The other countries with over 10,000 deaths are Brazil, Italy, France, Spain, and Mexico. The government of Nagaland has so far spent Rs 8.68 crore on maintenance of quarantine centers for returnees and Rs 1.65 crore for ferrying returnees to the state. The government has also decided to strengthen the health infrastructure with more new appointments in the offing. Briefing the media at Secretariat Conference Hall today, government's spokesman and advisor Monlumo Kikon said quarantine centers in 11 districts are being managed by the district task force and foods are being provided through catering system. He said the government has also spent Rs 1.65 crore for hiring 32 buses and 9 trains to bring the people to the state from 13 states.
So you will see that the government has been incurring these expenses so far for managing the quarantine centers and feeding our beloved returnees in Nagaland, in the quarantine centers. So any quality of food and all that issues is taken up by the caterer, and if there is any complaint, the district task force is tasked to ensure that the caterers do their duty for the money that we have paid them, for the buses, and also for the 9 special trains which we have hired is approximately 1.65 crores, which is 1 crore 65 lakhs. So this is for both the buses and the trains. So the government of Nagaland has spent this much to bring our beloved citizens to Nagaland, and also while they are in quarantine, to ensure that we pay for their food and lodging. This amount has been spent.
Meanwhile, to strengthen the manpower of the Health and Family Welfare Department, the State Cabinet has approved creation of 53 specialist doctors for all district hospitals. Also, creation of 1 post of Director Medical Education and Radiation Safety at the level of Special Selection Grade Pay Level 18. Creation of 5 posts of Zonal Leprosy Officer for Longland, Peren, Fek and Zinaboto at the level of Senior Grade Pay Level 15. Encadrement of 2 posts of District Vector-Borne Officer for Twengsang and Zinaboto into the cadre of the Nagaland Health Service, as and when the present incumbents vacates the same to be manned by medical doctors, and creation of 143 posts of staff nurse to be deployed in all the district hospitals. The Cabinet also approved age condonation of 28 staff nurses under Health and Family Welfare Department, and fresh appointment be made against the sanctioned post, regularization of 19 serving contract medical officers under the Health and Family Welfare Department, and regularization of 27 existing medical officers who have been engaged by the department for 1 year. Minister for Planning and Coordination Niba Krono said the State Cabinet has directed that this approval is a one-time relaxation of laid down rules and procedures for recruitment, regularization and condonation of age. Further, this one-time measure is in view of prevailing situation due to COVID-19 pandemic and will not be treated as a precedent. Krono added that a special train from Thiruvananthapuram, Kerala, which departed with 966 persons on June 9, will reach Dimapur on Saturday at 5:30 a.m. The train has been hired to bring stranded people from Kerala, Tamil Nadu, Telangana and Andhra Pradesh. Another special train from Delhi with about 1,000 persons will be leaving Delhi on June 14 at 6 p.m. and it will reach Dimapur on June 16, he said. According to the Department of Health and Family Welfare, out of the total of 107 active cases, 81 persons are at District Hospital Dimapur, 4 are at Assam Rifles Hospital Dimapur, 13 patients are presently undergoing treatment at NHAK Kohima, and 7 are at Chedama COVID Hospital. 2 patients are at Peren CHC Jaluki. All 107 positive cases are asymptomatic. 36 persons have recovered from Dimapur District Hospital, 2 from NHAK Kohima, 6 from Chedama Kohima and 5 from Twengsang. With this, the latest figures for recovered patients stand at 49. The district-wise distribution of cases by domicile district are Kohima 7, Dimapur 23, Mokokchung 0, Fek 1, Zinaboto 1, Twengsang 9, Mon 24, Wokha 7, Kifri 4, Longland 0 and Peren 72 with 2 others. According to the Health and Family Welfare Department, a total of 2,613 persons were screened today. A total of 5,003 cumulative number of samples were sent for tests, and results for 4,405 have been received, out of which 156 have tested positive and 4,239 samples have tested negative. A total of 340 samples were sent after 3 p.m. yesterday till 3 p.m. today. Results for 1,298 samples are awaited. A total of 342 samples were tested by TrueNat and 305 have tested negative. One sample has tested positive and 36 results are awaited. A total of 6,922 persons are presently under facility quarantine, while 8,190 persons are under home quarantine. The Twengsang District Task Force for COVID-19 held a meeting at DC's Conference Hall, Twengsang today under the chairmanship of Kumar Ramnikant, Deputy Commissioner and Chairman DTF Twengsang. The members of DTF decided to conduct 2 confirmatory tests for negative and 3 confirmatory for positive returnees before sending them off from the quarantine facilities. It was also decided to open up the intra-district movement of the buses and passenger vehicles, while the inter-district movement of commercial vehicles shall be put on hold. With regard to opening of the churches, the meeting decided that all rural churches can be resumed maintaining strict social distancing, while the churches in urban areas shall be advised to put on hold till the end of this month. That's all we have time for in this edition of News Broadcast, but before we leave you, here's a reminder that you can send in your videos at the WhatsApp number flashed on your screen and be part of this venture of being a citizen journalist. Meanwhile, stay safe, practice safe health hygiene and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.